Hi friends, we are live today, Wednesdays with Whitney. I'm Whitney, and today I am joined by Jason Mason, who is a firefighter for the city of Des Moines. Thank you so much for being here today.
Thanks for having me.
Absolutely. So, Jason, when did you decide to become a firefighter? Tell me about this. What is this journey about for you?
Yeah, so my father was a firefighter, and he always told me that I could make money with my mind, so don't, go into the fire service.
Yep.
He was talked into it by my mom's dad, so I'm actually a third-generation firefighter. Oh. Yeah, so I didn't tell you that earlier. So my mom's dad talked him into it.
Okay.
I went, I went to college and went into the office world, and I just was sitting behind a cubicle and was like, I can't do this. So I started asking my dad about it, and he's like, yeah, it's a great career. So. Yeah, followed in his footsteps.
That's awesome. So when you were growing up with your dad as a firefighter, what do you remember? Like, what were your first memories of firefighters?
I mean, I just remember it was like, I was the cool kid at school, being able to tell everyone my dad's a firefighter because, everyone else is like, oh, my dad is an accountant or whatever. And so my dad would come to school and do talks. And so I always thought that was super cool. So now when I go to my kids' schools, I'm always like, oh, this is really cool.
You get to do that too. You get to, I mean, in like the hero shows up. Like I just think about all of the TV shows, and I know that there's so much that goes on behind the scenes, and we're going to talk a little bit about today about what exactly firefighters do in the world, but like getting to show up and say like, I do go into burning buildings.
Yeah.
Like, I mean, it's very, very scary, but from an outsider's perspective, like the courage it takes to do that. Can you tell me a little bit about firefighter training? Like, what does that look like? What's the time investment?
Yeah, so it's kind of a long process to get hired on the job. It's about 6 to 8 months once you submit an application.
That's huge.
It's government, so everything takes longer.
Everything takes a little longer there.
Once you do get hired, there's usually about 300 to 400 people, and they whittle it down to about 12 that they actually hire.
Is that per hiring scenario, like per year?
So like every year they whittle it down, which they're getting ready to hire in January, and we're looking for people. So if anyone wants to apply, it's a great job.
Yeah.
So once you get hired, they send you to EMT basic school, which is 4 weeks, and it's just 8 hours a day for 4 weeks.
So you're also, as a firefighter, a certified EMT.
Yep.
That's
like
you
so
have
EMT
to be.
basic is like the most basic level. It's a semester-long class at DMAC that you can take, but we do it in 4 weeks. And then they send you to fire school, which is like 17 weeks. And then they send you to paramedic school. I did it through Mercy College.
Yeah.
And they just do a condensed version of that. So again, that was like 8 hours a day for, I don't remember how many weeks. It's been a long time ago.
Yeah, you've been doing this for a while now.
Yeah, a couple years. And then you have to do like 480 hours of clinicals. So you're in the hospital for 10 weeks or so.
So that's where you're getting a lot of your medical training?
Yeah, so you're working in the ER, you're working in the OB department, delivering babies, you're doing
that
as
firefighter training?
Yeah.
Oh my gosh.
All kinds of stuff. Every department in the hospital, we're there.
Yeah, and so is the point of that so that you just have a general working knowledge of any medical emergency that happens?
So as a paramedic, we do a lot of that stuff. I've delivered a couple babies in the field. So that's just one thing I can think of off the top of my head. But I mean,
how do you get that call? Like what happened?
Moms just wait a little too long, It's like their 4th or 5th kid.
Yeah, so, they're like, we're fine. We're gonna finish dinner.
Yeah. So I mean, I've been on 12 years and I've only had it twice, so it's not like it happens every day,
That just seems crazy to me, though. Yeah. But that's so cool to be like to know how to do that.
Yeah.
Oh my gosh.
It's kind of cool. I tried to talk my wife into letting us deliver our kids, but she said no.
So,
she's like, no. But yeah, I mean, car wrecks, just all the different scenarios that we go through. People that have breathing problems. Being a paramedic, you just have a lot of little things.
Yeah.
So.
Love that. So as a first responder, so tell me what that means. Like, so firefighters are normally the first people on any sort of scene. Is that true?
Yeah.
Can you tell me about that?
Yeah, so when you call 911, they dispatch us out.
Okay.
So a lot of people have questions about that. They do it all by computer. So you talk to a live human, but while you're talking to the live human, they're sending us out. So they're going to keep you on the line to try to keep you calm and try to talk you through. And they've been trained just in like knowing what to do and knowing to talk you through. So let's say you had an emergency today here at your house. They're going to say, okay, what's your emergency? What's your address? And they're going to get us going. And a lot of people get frantic and they're like, just send an ambulance. I need somebody right away.
Yeah.
And the ambulance is already on their way.
Oh.
In the city of Des Moines, it only takes us less than 4 minutes to get to a call. So we're here really quickly.
That's incredible.
Yeah, so and depending on where it might be, my station is downtown, so I'm right in the heart of downtown. we go to a lot to the Wells Fargo, Principal, Nationwide, and then the bars on Court Avenue. So we have kind of all those, a wide variety of calls.
What would you say when you get a call, like, what do you show up for a lot? So, when I think of a firefighter, I think about you fighting fires, but what I have learned is that's actually not a huge majority of your calls. Like, what are you responding to?
Yeah, so the majority of things we're responding to are medical emergencies. So I don't know an exact percentage, but I would say it's probably about 70%, 70 to 75% medical emergencies. Fires in the 60s and 70s used to be a really big thing, but now we have fire alarms, we have sprinkler systems. We've got a lot of things that kind of take care of that. Yeah, great buildings that are being built, and a lot of fire code that's put in place for that specific reason. So, yeah, a lot of the things we have now, as people are outside doing things and the population has gone up, you have those medical emergencies. So,
well, the whole reason that Jason's actually here today is about a month ago, I was listening to Kiss 107 FM in the morning, and they were doing a segment on CPR, and they were saying that, they're no longer instructing civilians to breathe into somebody's mouth. And I was like, wait, what? And I just had this sudden realization that I had no idea what to do if somebody in my presence had a medical emergency. Like, other than call 911, I would be totally useless. And for me to have that useless feeling, I was like, no, we can't have this. So that happened, and then it was a couple days later, and I was having dinner at Jesse's Embers, and somebody hit the ground. And I didn't know what had happened, and there was already a crowd around them, but I remember watching somebody breathing into this young girl's mouth and thinking, I don't think that's what they're supposed to do, but I don't know enough. I would never be the person to insert myself into that situation. So that's when I reached out into the Facebook world and was like, who knows CPR? So Jason and I met on Facebook. He gives highly recommended. And so I'm super excited that you're going to tell us a little bit about, okay, here are some medical emergencies. What can you do to keep someone alive or stable, or just, what are those first steps before you guys get there? Again, it's 4 minutes that you have to make sure that somebody's okay, but what can we do in 4 minutes? So first thing we're going to do is talk a little bit about CPR. So we've got this. I'm just going to tip this down.
Okay.
So Jason, can you tell us what we've got going on here?
Yeah, absolutely. So I'm also an American Heart Association certified instructor. So I do a lot of this training. Kind of what we're going to show you is not going to be really a substitute for getting certified, because I always recommend getting certified, to have that. It's always nice to have. You know that you're certified, and we go into more detail with using an AED and stuff like that. But today we'll just kind of go over the dummy. If you don't have the training, just kind of what to do when you show up. So
perfect.
American Heart does a hands-only CPR now. So you don't have to do the breaths anymore if you don't have the training. There's been some commercials. The guy from The Hangover, the doctor that teaches, you do it to the beat of Staying Alive. So that's an important thing. If you're a dental hygienist or daycare provider or a teacher, you have to have a training that's a higher level than this. So you will still do the breaths. Okay. Some people have pocket masks. This is a little keychain. I don't know if you can see this. Some people will keep it on their keychain. Basically, what's inside is just a barrier device mask like this. So,
is this for if you were going to do the breaths?
Yeah, this is for if you were going to do the breaths. Now, like I said, that's a different training. If you're just a layperson and you're at Jesse Embers and you see someone go down, what you want to do is you want to make sure that the scene is safe. So you want to make sure this guy isn't laying on down electrical wires or he's been shot, because your safety is the most important, obviously. And then when you come up to this patient, you want to push hard and fast on their chest. You're going to do it to the beat of Staying Alive, which is about 100 to 120 compressions a minute. So they need to update their song, I think. We need to figure out more 2018 version.
Is there a Justin Timberlake song that would be?
I don't know, there might be. I should probably look into that. So
that would be a great value add.
So this guy, he's already got his shirt off, but the anatomical landmark is going to be your mid-nipple line. So you're going to go right there. And then when you do that, what I tell people is you want to use the butt of your hand. You're going to put it right in the middle of their chest. You want your arm locked in a straight line, so you don't want your elbows out like that. This is going to be a little different.
Gives you more leverage?
Yeah. This guy's on a table, so most likely he'll be on a floor. I'm going to interlace my fingers like this. And then I'm going to have my shoulders directly over my wrists. When I do a compression, I'm pushing down all the way until I feel resistance, and then I'm going to come up all the way. So this is what our compressions are going to look like.
Oh, that's very fast.
It is pretty fast. So just
So if you do that for 4 minutes, that's your cardio for the day.
Yep. So American Heart recommends you switch out every 2 minutes.
Like with another person?
With another person,
okay.
Yep. So,
that makes sense.
If you have access to that, you might be in a situation where you do, or you might be in a situation where you don't. So every situation we come into contact with on the fire department is different. I've been on the job 12 years, and every scenario is different. You might be here at home with a loved one, and it's just you.
Yeah.
You might be at Jordan Creek Mall. There's 50 people that jump in, and they help, and they're like, oh, hey, I'm a doctor, I'm a nurse, I'm a paramedic, whatever. So.
And then when they say that, I just walk away.
Right.
And I make sure that 911 was called. That's my role there.
Yeah, but it's really great. You talked earlier about just getting in and doing something. Yeah. That's the most important part. When I was in paramedic school, we were eating lunch in the cafeteria at Mercy Hospital. And it was all doctors, all nurses, and a lady stood up and she started choking, and she's doing the sign for choking and everything, and nobody did anything. I think everyone was just kind of like... Shocked.
Yeah.
So one of the guys from my paramedic class jumped up, did the Heimlich, and ended up saving her. And so I tell people all the time, like, don't worry, just get in there and do something. Yeah. So something is better than nothing. So
say I don't know how to do the Heimlich, what do I do if someone's choking?
Yeah, so we can go over the Heimlich real quick if you want to know that.
Let's do it.
They haven't changed the Heimlich for 50 years because it's really pretty a tried and true method.
Yeah.
So if this person is doing the universal sign for choking, they're just going to have 2 hands around their throat.
Which I feel like you just do, not like, even if I didn't know that was it, that's what I would do.
I think.
Yeah, it's just what our brains do when we're panicking about it.
Yep. Okay. So the person is doing that. You want to come up to them and see if they can force air on their own. So you're going to say, sir, can you cough that up? Can you force that air?
Yeah.
If not, you're going to ask them / tell them you're going to come up behind them. I never recommend coming up behind someone and just putting your arms around them. That's kind of frowned upon. So you want to come up behind them, and you're going to put one fist right above their belly button, and then your other fist you're going to grasp, and you're just going to push in and up until that patient...
In and up? Yep. So like into the rib cage?
Yep. Okay. Yep. So you're just going to, until that patient coughs up the item, pukes it up, whatever.
Okay.
If it doesn't work, and they are not relieved of that, and they pass out, they go down to the floor, we're going to start our CPR steps. So you're just going to start your compressions right away.
Okay.
So, and like I said, we'll be there in less than 4 minutes, so it shouldn't be a problem. But now's a good time of the year to kind of go over this because we're together with family, Thanksgiving, Christmas, and you might have aunt or uncle that's 80, 90 years old, maybe not in the best of health. There's a lot of food being thrown around. So, it's good to know.
I love that.
Yeah.
Okay, I would not have any idea how to do that. Okay, the other thing that is kind of scary is seizures.
Yeah. So
first of all, how do you know? Okay, seizures and strokes.
Yep.
Those are 2 things that, like, seeing the warning signs, and what are those warning signs, and, like, how should somebody handle that in those 4 minutes?
Yeah, absolutely. So a seizure, there used to be a wives' tale that you'd stick something in their mouth so that they didn't choke on their tongue. They wanted you to put a spoon in there. Yeah. Don't put anything in their mouth. So the best thing you can do for a seizure is just clear the space around them. Okay. That patient is going to, have a tonic-clonic movements. Yeah. You just want to give them space. So it's basically just the jerking you see, like if you see it in the movies or TV, they'll just be, having that seizure-like movements. You want to just give them space so they don't hit their head on, furniture or whatever. And then when they get done seizing, you just want to put them in the recovery position. So just put them on their side, in case they throw up or something.
Not during, but
not
after.
During, just after, yeah.
Okay.
So, sometimes when they are having that seizure, you can protect their head so it doesn't, bang on the ground. Okay. That's something, but never stick anything in their mouth. Okay. Don't try to blow into their mouth, anything like that. So you just basically want to give them space. Call 911 right away. Yeah. For a stroke, we always tell people, call 911 if you ever have any questions. It's better to have us come out and not be needed than wait too long.
How do you know that someone's having a stroke? There's like some very good, very clear warning signs, right?
Absolutely. So with the stroke, they'll probably have some weakness, some slurred speech, and maybe some facial droop on one side or the other.
Slurred speech that's not related to holiday activities.
Right. Yeah. Non-alcoholic slurred speech.
Yes.
Yeah. So, stuff like that. And when a patient does have a stroke, there's a 3-hour window that you can reverse that stroke. So really don't waste any time.
Right,
sometimes...
Do you move them, or would you suggest you guys coming out and transporting them?
We would transport them. Yeah.
So I would. So don't just take someone to the hospital.
Yeah. I mean, you can if you're in if you live out in the sticks and it's going to be 20 minutes for EMS to get there, just get them in your car and start going. But if you live in the city of Des Moines, just call, a professional, and we can just do everything.
Because that would scare me if, obviously they're having this medical, trauma, and then trying to move them to.
Yeah, because you know, on the
I'll
way,
call the professionals.
Yeah, on the way to the hospital, we can start an IV. So then, the minute they hit the door, they can get the drugs they need in that IV and clear things up. So
cool.
Yeah,
awesome. Any other scenarios? Oh, somebody falls and hits their head.
Yeah, so if somebody falls and hits their head, you just want to leave them in place. Don't move them. If you need to do CPR, do CPR. If they're not breathing. But other than that, just if you're ever in doubt, call 911. So, we try to tell people if it's something as simple as a toothache, use some common sense a little bit. Don't call 911.
Yeah, maybe the emergency room.
Yeah, if you need to get your meds filled, which we go out a lot on stuff like that. Someone's like, we're out of our medications, we need to get it filled. The emergency room is not the place for that. Your family physician.
Yes.
But if you ever have any doubt, I tell kids all the time, just call 911. We can show up and then find we're not needed. It's better to do that than wait too long and not need us. So.
Well, thank you so much for coming today.
Thank you for having me.
I learned a ton.
Good.
So thank you all for watching. And I think I just really wanted something in the holidays for us to go in and feel like we're prepared if something does happen, but also just knowing that you guys are literally 4 minutes away.
Yeah.
It was a huge relief for me. That was one of the most exciting things I heard today, other than relearning that Heimlich move. Awesome. So we'll see you guys next week right around Christmas. Bye, guys.